any day. My name is Fumi Bangbala, and this morning we're going to be talking about a topic that affects men and women, but in this part of the world, we say more women based off of. Anyway, let me get into it. Infertility, but very specifically, we're going to be talking about investigating infertile couples. For many couples, the journey to parenthood does not happen as quickly as easy as expected. Months turn into or weeks turn into months into years. Questions begin to arise not just from yourself, I say women in quotation marks, family members, friends, loved ones, and unfortunately, in many societies, especially like in societies like Nigeria, the woman is often blamed first. In fact, she's the only one that is blamed. You don't remember that, oh, some men do have some fertility issues. So today we're going to be investigating infertility in couples. When a couple struggles to conceive, what should doctors look for? What tests are performed? How do specialists determine whether and which the challenge lies with ovulation, maybe the fallopian tubes, maybe sperm quality, like I mentioned, hormonal of others. Why is it important for both partners to be evaluated? This one I stand gidigba. Both partners should be evaluated. But for today is Dr. Nasir Ibrahim, who will help us understand how infertile couples are investigated, what both men and women should know about fertility assessment. Before we bring him on, we are live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. The phone lines will be open shortly, but in the meantime, you can send your text messages to 73756 or 8155 Okay, bring in our Dr. Nasir. Good morning and welcome to the show. You are muted, Dr. Ibrahim, and we cannot see you. Hi. Hello.
Hello, good morning, the anchor.
Morning. Me. How are you, sir?
I'm fine, and you? Hello?
Okay, can hear you now. How are you this
Oh,
morning?
I'm fine. Good
Awesome.
morning,
Good morning.
everyone.
Welcome
Yeah.
to the show. Okay, thank you for doing this with us. But first, I want to ask, what does infertility in couples, what does it mean? Especially when we are classifying a couple as infertile, what does it mean?
Okay, thank you very much, presenter. Uh, the word infertility or infertile couple is a literally English word. However, there are slight technicalities that is attached to this word. So, medically speaking, a couple will be deemed to be infertile or a couple will be diagnosed as having infertility issue when a man and a woman has decided to get pregnant and they've been living together or they've been seeing each other at least 3 to 4 times in a week. And seeing here means they've been having intercourse that is not protected for 3 to 4 times in a week. And this is done for 52 weeks, which is equals to a year. And all through this period, they were unable to conceive. I mean, pregnancy did not occur. So for such a couple, we said uh, is suffering from infertility. And the reason behind this is simply because at that level of sexual exposure, more than 98% of people are expected to have conceived. So if you are not conceived, then that means there is a problem. So so a couple will be classified as infertile when they have sexual intercourse 3 to 4 times in a week, unprotected, and that is done for a complete 1 year. However, there are little caveats to this. This applied to a couple that are within the fertile reproductive age. However, when you are slightly at the upper limit of reproductive age, like you are above 35 years of age, we don't wait, and there's no history of pregnancy in the past. So we don't, that's 52 weeks, which is 1 year, does not apply to such an age group. And like you alluded to it in your opening remark, that the cause of this could either be from the male or female. And to amuse you, uh, we have almost equal percentage of contributor from both sexes. So a male or the husband will contribute about 50% of causes of infertility, while the female too we contribute such a percentage. So I don't know if I rightly answered your question.
Yes, yes, you did. Thank you so much for that. So, I want should a couple stop waiting and start to seek professional help?
Okay, thank you. So now seeking professional help is actually depends on the age and the urgency at which this pregnancy is needed. Before you diagnose infertility, that's what we call subfertility. When a man and a woman meet for 3 months, and this meeting, this sexual exposure is frequent, up to 3, 4 times in a week, and they do this for 3 months, and there is no results. Such couple are not doing too much to prevent themselves gynecology to gynecologists for evaluation, because at that level of exposure, more than 35% of people will have conceived. Fine, there's still reasonable number of people that might have not conceived, despite the fact that they don't have any medical condition that is preventing this conception. However, when a woman has this frequent sexual intercourse for 3 months and there is no pregnancy, that is the right time for them to try to speak to their doctor for counseling, for some investigation. However, at that level, they are not fitting into the category of infertile couple, but sometimes just ordinary counseling. Do this, don't do this, do like this, don't do like this, could have solved their problem. So it is never too early to see a doctor, and it is never too late to see a doctor. However, it is advisable that when you have frequent sexual intercourse for 3 months and no issue, and you are within the age of the productive year, then you should see your doctor and pick it up from there. Thank you.
Okay, thank you so much for that. So, how common is infertility among couples? At the beginning, you said, or if you have been having sexual intercourse for a while and you don't and there is no you're not seeing any results, then go see a doctor. How common is infertility among couples? Because people think, oh no, it's not a common thing.
Oh, so many studies have been done to try to look at the prevalence of infertility. And the most commonest one, or the one that is generally agreed upon, is that one fifth, one fifth of couple are infertile. And when you take this one fifth, what it means is that when you have when we have 10 couples, two are not infertile. When you have 100 couple, 20 are infertile. When you have 2,000 couple, 200 are infertile. So it is actually a very big, the prevalence is actually very high. And that was, in fact, this particular figure that I quoted, it is done when there are no external interferences. What external interferences in terms of the lifestyle modifications? Now we are subjected to a lot of we are exposed to a lot of things that also compounded this issue of infertility. So I would be surprised if another study, a new study will be done that will also reveal a prevalence that is more than this. But infertility is very, very, very common. In fact, I must tell you from my experience, when you see 10 patients in gynae clinics, you can be sure that at least 4 out of these 10 people, they actually come with problem or
Hmm.
complaint of infertility.
Hmm. Okay, let's keep it moving forward. Uh, how does it influence, influence infertility? Let's
So,
quickly to start the investigation.
okay, so before we go to the investigation, I think it's important for us to know that the 30% of the causes of infertility is a result of a female causes of female problem. Another 30% is a result of men problem. And then another 30% is a result of the combined problem of the male and female, while the other 10% may actually be unexplained because it's also possible that after your investigations, you may not be able to pinpoint that this is the cause of the infertility. Now come to going into how to investigate if infertile couple. You see, there's no logic, I mean, there's no magic into it. When you look at the female reproductive tract, from the opening into the mouth of the womb, into the womb itself, onto the tubes, then to the egg. These are points of investigations because at every point of this part of the female reproductive organ, it can actually causes infertility. Then when it comes to the men, is actually the testes. So for the men, the investigation will focus on the problem before the testis, the problem at the testis, and the problem after the testis.
Okay, thank
So
you so
yeah,
much. I really like the data you gave that 30% is the woman, 30% is the man, 40% is combined, and then
yes,
10% is unexplained. So why
explain,
is it
yes.
that based off of this data you've given us now, why is it that the focus is always on the woman who, from the data you have shared, only 30% of the matter?
Yes, the issue is because of this uh should I call it unawareness and deceit? Because as far as I am concerned, I advise my patient that when they're coming to gynae clinic, they should come with their couple. Because what you hear from the wife is when you ask them, what about your partner? They say, oh no, the man said he's fine. How did he know he's fine? He said, somebody just told me I impregnated her.
Yeah.
Somebody that is not in your house, that you don't know the source of the pregnancy. Maybe the lady is even telling lie. So it is society contributed. The man think that because he's seen another lady, a girlfriend outside, and the woman said she's pregnant, he think he's responsible for that pregnancy and thought he is fine. And there's this erroneous belief that when a man ejaculates, then every problem is solved. Whereas the law of ejaculates that cannot translate to pregnancy. So I think is a societal problem, and we need more advocacy for men folk to know that they were equal contributors to the causes of infertility.
So much for that, Dr. Ibrahim. So, based off of that, how are you able to, administer help to a couple? And you've already said that, oh, it is only most times what we see is just the woman who comes, the man assumes that he has no problem. So, how then do they get a solution if the man is not coming to the hospital? What's the way forward?
Thank you very much. And this actually delayed solution because sometimes the way the evaluation of infertility is structured is to just take 1 month. And this 1 month, you do a couple of tests that involve the man and the husband and the wife or the partners. You understand? Now, when one partner refuse to show up, and you keep on to investigate one partner, and at the end of the day, you find out that there's no problem with that partner. So it's become a problem. One, there is this anxiety from the other partner that this one has gone on, they say there's no problem. Then maybe it's me that there'll be problem. So they refuse to present. So it's actually a management dilemma to the gynecologist. However, However, for those ones that were able to cancel ab initio, sometimes we speak to their husband, you understand, through their phone and try to encourage them that we are we are at a stage in our medical sojourn now that except you are not trying, nobody will die without having a child of his or her own. So there's not any problem that can be identified that cannot be resolved. By the time you tell them, you enlighten them this, then most of the men folk presented themselves for evaluation.
Thank you so much. Now, still on the men, before we move on, there are a lot of men who believe that because they have normal sexual function, it means that they cannot be infertile. So can a man have normal sexual function and still have fertility problems?
Perfectly, perfectly. You see, uh, erectile dysfunction is a cause of infertility, but it's not the only cause of infertility for a male. So now, if you have erectile dysfunction, there are a lot of things that can make you to have it. If you have other medical conditions, you have diabetes, mellitus, you have uncontrolled hypertension, you have neurological problem, you may not actually have that erection. But even when you don't have that erection, it doesn't mean you don't have sperm, and it doesn't mean your sperm cannot impregnate a woman. So you see, it's a different thing. Now you may not have this erectile dysfunction, but you have inherent sperm problem because in a semen, let me call it semen for people to understand. In a semen, there are certain criteria that your semen must meet up with before that semen can be seen to be fit to impregnate a woman. So, having erection, frequent ejaculation does not zero you out or does not demote you out from the cause of infertility challenges that couples are facing.
All right, thank you, sir. So let's talk about female fertility assessment. So what kind of information are you looking for when a woman comes to you for an initial consultation?
Okay, thank you. So this is where I would like to counsel our women out there that there is no two individual that are the same. And when you come to doctor, you see this word we usually tell our the younger doctor that you have to individualize to your parent, I mean your patients. It doesn't mean that Mrs. B or Mrs. Rebecca that was not they had infertility challenge, and doctor asked her to go and do HSG and do scan, and you too because you're having infertility challenge, you felt okay, let me go and do HSG and scan. No, it doesn't work that way. So we have varieties of investigations to be done. However, it is your interaction with us, which we call taking history. It is the history, our engagement with you, that will direct us to streamline the type of investigations that will best suit the cause of our own problem. Like I've said earlier, all the different parts of the female reproductive organ, from the opening to the mouth of the womb, to the womb itself, to the tube, to the eggs, to the abdomen, can cause infertility. And when you want to investigate all these different structure or part of the reproductive organ, then you spend quite a huge amount of money. However, your interaction with the doctors will help the doctor to streamline and say, okay, go and do this and this and this, go and do this, don't do this, so that we can actually identify what is the barrier or the hindrances to you getting pregnancy.
Oh, take an out, and then when we come back, we shall continue this conversation.
Thank you very much.
17.
Are you number 87? Okay, please wait. How many hours have you wasted sitting in hospital queues just to see a doctor for 10 minutes? There's a smarter way. Introducing TeleDoc, your secure digital platform to consult verified doctors anytime, anywhere. With TeleDoc, you choose how you want care. Need something quick? Go for a quick consult. Just 10 minutes. Need more time? Book a full consult, 30 minutes of personalized care tailored just for you. No traffic, no crowded waiting rooms, no unnecessary delays. Simply book at your preferred time. Join a secure video call inside the app and speak directly with licensed doctors you can trust. Have medical records? Upload them easily before your consultation. From general health concerns to specialist advice, TeleDoc connects you to real doctors, real answers, real care. Download the TeleDoc app today on Google Play Store and Apple Store.
WFM 17.
Welcome back. This is still Women Radio 91.7 FM, the voice of women, Nigeria's first and only radio station for women and their families. We've been speaking with Dr. Nasir Ibrahim on investigating infertility in couples. That's our topic today on Radio Doctor this morning. And yeah, I'm going to ask my next question. Dr. Nasir, you mentioned the things that you check during the initial consultation. I want you to what about things like PCOS, now PMOS, fibroids, fallopian blood tubes, tubal ligation, all of that? Do they play in when it comes to infertility?
Yes. Thank you. You see, now you are going into the etiological causes. You understand? And when you talk about PMOS, you understand? When you talk about blocking tube, and now the way it works is okay, fine.
Yeah.
So when you talk about the blocking tube, we are talking about the tuber pathology. So now we are not looking at the blocking tube, we are looking at what are the causes of blocking tube. So if you come to me now and tell me that you've never had a PID, pelvic inflammatory disease, you've never had it in your life, you've never had miscarriage in your life, you've never had a tuberculosis in your life, you've never delivered and had infection after delivery, you've never had a surgery, and you don't have painful menses, it is out of point for me to go and say, go and do a HSD, because what will cause blockage of tube, you don't have the history. So that's what we're talking about, seeing an expert before you go and waste your money to do investigation. You understand? Now, when you talk about, let me say PCOS, as commonly known, is an endocrine disorder. You understand? And before I will say, okay, how do we make the diagnosis? There are clinical habitudes. There are things we see in you. There are history you give us. Doctor, I don't see my period every month. You understand? I don't see my period every month. It's delayed for like 2 to 3 months before they comes, and then when they come heavy. Doctor, I go here, I have beard, I have oxfox, what's the other one? I have acne. You know, all these things, they are clinical stigmatas of PCOS. You understand? And before we tell, okay, go and do an ultrasound, and we can now say, okay, go and do a hormonal profile to now make our diagnosis of. So what is most important is you seeing a doctor, try to speak to a doctor, tell them what are your problems, and the doctor will now streamline what are the likely causes. Okay, it could be this or this. Now let us now do investigation to now confirm which one is it. Now when that confirmation is made, we're now going into treatment proper.
All right, thank you so much, Doctor. For people, how can telemedicine help couples take the first step toward evaluation?
Oh, perfectly. You see, now the problem we're having is in twofold. One, there is scarcity of specialists in terms of geographical location. For instance, now for my village, what we have in my village is a primary health care center that there's not even a doctor there.
There's
So
no
for me
doctor.
to go to town to the state, that in most of the primary health care center, you don't find doctor there. It is not that they're trying to put doctor. What you find there, and you might not even find nurses. For you to be said the truth, you find you understand. Those are the people you likely find in the primary health care center because the money they pay, a nurse may not want it, so she may not actually stay there. You know, it's actually being manned by a local government. It's now that the federal government is trying to make some interventions and trying to ensure that at least there's a doctor in every primary healthcare center, and that doctor will not work 24/7. And even the way infertility clinic run is not a conventional things that you are rushing. You may see one patient, you understand, it take experts for you to know what to ask and what you need to get from the patient. So now telemedicine has bring the expertise to the doorstep of every individual without spending much. So what it means is that if you are in anywhere in this country that can have an access to internet, you can actually meet and talk to experienced obstetrician and gynecologists without spending much. And uh, what it has afforded you is that it has reduced the cost of finding an expert, finding an hospital. And when you also get to the hospital, the waiting time, for instance, now I tell my patients, when you come to my clinic, you should just prepare that you are leaving the whole of that day for the clinic because I don't gynae clinic from 12, you understand? And you don't come 12 and say you want to see me. So if you need to see doctor at that 12, you need to come between 8 and 9 to be booked. So it means I mean, that working hour has been wasted. And imagine somebody that is doing daily work or a business person, you can know what you might have lose for that a whole day that you dedicated to see a doctor. And these teledoctors, I mean, the telemedicine has made it available that from the corner of your room, you can speak to the expertise of your choice, and you get the same results as coming to a teaching hospital or our private clinic to see us.
All right, thank you so much, Doctor. The phone lines are now open today on Radio Doctor. We've been discussing investigating infertile couples, beg your pardon, understanding male and female causes of infertility. So if you have questions about fertility testing, conception, reproductive health, or fertility treatments, you can call in now and speak with a doctor on 07000 or 0800 1235 917. But you can send a text message to 073 or 55 917 917. Okay, let's get to treatment. Does fertility problem require IVF?
I mean, what's the question, man?
Dr. Ben, we can't hear you any longer.
Oh,
Dr.
hello,
Okay, yes, I can hear you now. My question
hello.
was, my question
Oh,
was,
thank you.
okay, my question was or is, does every fertility problem require IVF?
No, 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 no. In fact, more than 20% of infertility problem does not even require a medication. It just required a counseling session with a gynecologist. So it's only very, 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 very few, like between 25 to 35% of infertile couple that we need an in vitro fertilization, which is the IVF. So it's not all.
Thank you so much, Doctor,
Hello?
for that. Dr. Ibrahim.
Yeah,
Yeah. Okay. So I
you're
wanted to ask
welcome.
a question on men's sperm. I know I've asked you quite a few questions, but um beyond what does not I think you've already answered the question. What does a semen analysis actually measure?
Oh, thank you very much. So the semen analysis, you understand, there are parameters that the semen analysis measure, and these parameters are periodically evaluated by World Health Organization. And these parameters include one, what is the volume? What is the volume of a semen that a man can produce? So after this, after the volume, what is the color? Because from mere color of the sperm, you can know that, okay, there is a problem, there is no problem. Now you come to the thickness. In the terms of the thickness, the test is going to look at how soon will the sperm dissolved into water. So the thicker it is, the the longer period it takes to dissolve. And the thinner it is, the earlier it's dissolved. And you know, when a sperm dissolved, the movement of that sperm is hindered because it will come down since there is no covered in the female reproductive tract. So after looking at that, then the semen analysis, we also look at what is the morphology, what is the structure, the shape, because a typical spermatid, it has a head, a neck, the body, and the tail. So you have some without the tail, you have some without the head, you have some without the neck. So it's going to look at, okay, what is the percentage of the one that has good structure? What is the percentage of the one that doesn't have the structure? Now, you now come to motility. What are the percentage of the one that can move, that can go straight? You know, the way sperm move is supposed to be moving forward. Now, there are some sperm that they move backward. There are some sperm that they move to this side. So it's going to analyze that. Now, another analysis is going to done is that, okay, among this one that is moving straight, how fast are they? What is the percentage of those ones that move slow, very slowly, and what are the percentage of those ones that move very fast? Then lastly, it's going to also look at there sign of infection in that semen, and that is usually interpreted by the number of the pulse cells that is seen in the semen. So these are various things that seminal fluid analysis is going to look at.
All right, thank you so much, doctor. Not to take you back, but I want to ask you a question still on telemedicine. Excuse me. A lot of people would rather go to the hospital to go see a doctor, especially our older citizens. They are like, no, they want the doctor to examine them. They want the doctor to check them. Now, if you say that, oh, if I have internet connection and I can speak to a doctor, how is telemedicine able to reassure patients that they are getting the same treatment if they were sat physically in front of a doctor as opposed to online, doing it via the internet?
Okay, thank you very much. You see, this process of listening to you, carrying out an examination, then going into the investigation, that examination is also helping to support the part of the history that you did not get well. For instance, now, I asked you, madam, do you see milk coming from your breast? You said, no, I'm not sure. I think that sometimes now, as a doctor, I can now examine and try to look at the breast, press the breast, and see if the milk comes from it, which the patient can actually do on their own. I think you agree with me. Now, okay, you want to press the abdomen to check if the womb has enlarged, because if the womb is enlarged, then the possibility of fibroid being in that womb will be there. You see, if you don't have opportunity of doing this one, even when you have opportunity of doing it, you still said go and do scan. So when you've done scan, doctor can as well evaluate the scan and tell you what is going to see when he physically examined you. So not carrying out physical examination is not taking much out of consultation, because most of those things that we are looking for when we do examination, they were things that the investigation is going to show us, or investigation is going to confirm for us. So to conclude, I will say that there is no, you are not losing anything enough, I mean, except for that comfort. Some just want to that empathy, which also you can do through a video. You understand? So you're not losing anything in doctor not touching your body in arriving at the correct diagnosis of the causes of your infertility.
Thank you so much. Finally, as we go, there's people that don't know they're infertile. People only find out that they're infertile when it comes to start giving birth, right? So, what final advice would you like listeners to know about fertility investigations and why they should seek help early?
Yes. So now, that's what we tell the young couple that we have opportunity of encountered now. One, if you are not married and you have boyfriends that you're having unprotected sexual intercourse and not through the period you're having it, there is no issue. It's a cause for concern. You should talk to your gynecologist. If you are a woman and you are a career type of woman or you're a woman that you are not prepared to get married on time, then you talk to your gynecologist because there are procedures where they can help you to keep your egg and make your egg to be viable to the time you will need it for your reproduction. So if a woman that you don't have a regular menstrual pattern, is a pointer to you to see your doctor. If a woman that you have pain when you menstruate, is a pointer to you to talk to your doctor. And when there are also fertility checkup that you can also say when a woman between 25 and 35 that either you are married or you are not married. No, not this time around now, you are not married. You understand? You should be concerned about your reproductive profile. So you can also see a doctor and say, okay, doctor, I want to carry the test to be sure that I'm ovulating. Because when a woman ovulates, then like 80% of his infertility is solved. You understand? So I think for every reproductive age group, either you are married or you are not married, you should be concerned about your reproductive profile by talking to a gynecologist to be sure that everything is in order. And if there is any aberration, you can start any correction of those identified aberrations.
Thank you so much, Dr. Nasir Ibrahim, for coming on the program today, for giving, like, really, really breaking down, understanding the investigations to do when it comes to infertility with couples. Thank you so much for coming on the program.
You're welcome, ma'am.
All right, enjoy the rest of your day, sir.
Same to you.
All right, this is still Women Radio 91.7 FM. Thank you for listening to us this morning. Radio Doctor is broadcast 10 a.m. to Mondays through Fridays every weekday. Join us tomorrow for another edition, the final edition for the week by 10 a.m. You already know once it's Friday is Dr. Abiola. So please stay tuned. This is the Women Radio 91.7. We have great music to keep you company. Bye for now.
You're listening to the voice of women. It's not just talk, but it will take you to play everything and we play them better.
To sponsor this program, call the number 0816 480 7613.
Nigeria, a nation of many languages and many tribes. We will stand together, live together, and grow together. United we stand, united we thrive. This message is brought to you by Women Radio WFM 91.7 FM.
Are you number 87? Okay, please wait.
How many hours have you wasted sitting in hospital queues just to see a doctor for 10 minutes? There's a smarter way. Introducing TeleDoc, your secure digital platform to consult verified doctors anytime, anywhere. With TeleDoc, you choose how you want care. Need something quick? Go for a quick consult. Just 10 minutes. Need more time? Book a full consult. 30 minutes of personalized care tailored just for you. No traffic, no crowded waiting rooms, no unnecessary delays. Simply book at your preferred time. Join a secure video call inside the app and speak directly with licensed doctors you can trust. Have medical records? Upload them easily before your consultation. From general health concerns to specialist advice, TeleDoc connects you to real doctors, real answers, real care. Download the TeleDoc app today on Google Play Store and Apple Store.
Jíjẹ́ ọmọ ẹgbẹ́ Women Radio á fún ẹ ní àǹfààní láti darapọ̀ mọ́ àwọn obìnrin bíi tiẹ̀, yálà akẹ́kọ̀ọ́, oníṣòwò, oníṣẹ́ àdáni, òṣìṣẹ́ fẹ̀yìntì, ìyàwó ilé tàbí àgbẹ̀ ní gbogbo ìjọba ìpínlẹ̀ 36 ní Nàìjíríà. Tó o bá ti jẹ́ ọmọ ẹgbẹ́ Women Radio, a ó bẹ̀ polówó okòwò rẹ lọ́fẹ̀ẹ́, ó sì ní àǹfààní láti jẹ ẹ̀bùn tó jọjú lórí àwọn ètò wa. Forúkọsílẹ̀ ní wfm917.com, darapọ̀ mọ́ wa lórí Facebook, kó o sì download mobile app wa níbikíbi tó bá wà. Jíjẹ́ ọmọ ẹgbẹ́ Women Radio jẹ́ ètò láti iléeṣẹ́ WFM 91.7 pẹ̀lú àtìlẹ́yìn MacArthur Foundation àti Nigeria Media Innovation Program.
Women lives matter, as too many women are still at risk during childbirth in our communities. And it doesn't have to be so. That's why the Women Advocates Research and Documentation Center, WADC, through the Transform Project, is bringing the conversation to the people. It's the Town Hall Meeting, a live platform where mothers speak from experience, health workers share realities from the field, and policymakers respond directly to community concerns. No barriers, no silence, just honest dialogue, accountability, and action. Because when communities and leaders come together, we can strengthen maternal health care and prevent avoidable deaths. Join WADC at the Town Hall Meeting and be part of the conversation driving real change in maternal health. No woman should die while giving birth.
The stories are real.
Something like this happened to me years back. I saw some messages in his phone. The lady that sent the message to him, when I wrote him, I said, "Oh, why are you like this? Why are you doing all this?"
All around you.
Come up to you to tell you how to do it. You should be humble enough to listen. If there's something you can do about that, you do it. Is it reading books? Is it seeing a therapist? Be open to certain things, because at the end of the day, this person is your partner. This is the bottom line of everything. Family advised him to marry the girl he has submitted. We forced him, but he refused. When the guy starts doing that, they tell us so much. When they come to fish.
Want to hear it? Break the silence culture. Adult Conversations. Weeknights from 8 on WFM 91.7, the voice of women.
Appreciation.
I'm grateful for my family, for my mom, for our grateful for my So I'm grateful for God's favor over my life. I'm grateful for growth. I'm grateful for prosperity and His grace over me and my family.
Yes. What are you grateful for? Share with us that one thing you're grateful for. Every Saturday morning, 8:30 on Women Radio 91.7 FM. Tell us what you're grateful for.
8:30 a.m. Saturdays on Women Radio 91.7 FM is all about gratitude and Thanksgiving.
So, what are you grateful for?
Radio 91.7, amplifying women's voices every hour, every day.
Are you there? Baby, are you there? Ready for this? Me girl, I've been looking for you in the end. It's a real thing and I pretend. Steady with me round down in the bed, oh girl. You got me sitting on the bed, you know I've been calling. You don't wanna answer me. Baby, I've been calling. You don't wanna answer me. Yeah, baby, I've been calling. You don't wanna answer me. All day I've been calling. You don't wanna answer me. Girl, I've been falling for you. Falling down by the wayside, girl, I've been falling, my love. You've been a man, I'm calling me, always fine. Seeing how you're wanting, you know they give me warning. You put me on a long thing, we ain't even talking. You ain't even online, but you got me locked in. Give me one time, baby girl. Give me one time, make a rewind, darling. So you no play, no games. No waving, no high flag for you. No play, no games. Cause you know say I'm falling for you, so I'm calling. You don't wanna answer me. Baby, I've been calling. You don't wanna answer me. Yeah, baby, I've been calling. You don't wanna answer me. All day I've been calling. You don't wanna answer me. Lockdown, you got me locked down. Lockdown, me locked down. Looking for you before the sun comes down. You got me looking like a fool. I fell in love with a player. I was kissing her, but she was fixing the paper. No. You got a bad man for it. Going through looks like Jordan. Give me one time, baby girl. Give me one time, make a rewind, no time, no games. Baby, no I flag for you, don't play, no games. Cause you don't say I'm falling for you, calling. You don't wanna answer me. Baby, I've been calling. You don't wanna answer me. Yeah, baby, I've been calling. You don't wanna answer me. All day I've been calling. You don't wanna answer me. Are you gonna pick up the phone? Pick up the phone. Are you gonna pick up the phone? Pick up the phone. Why you wanna leave me alone? Leave me alone. Why you wanna leave me alone? God, you don't wanna answer me. Baby, I've been calling. You don't wanna answer me.